Okay, good morning. Thank you everyone for joining me. My name is Dr. Chudley Wirch. I'm president and founder at Prevention Plus Wellness, located here in beautiful Jacksonville, Florida. So thank you for joining us for today's webinar. It'll last about an hour. I'd say I'd like to cut it shorter than that so that we can open it up for the last 10 minutes for Q&A. So that's my plan. I've got some slides I'm going to show you, and then I will also walk you through some of the program manual. We'll start with the high school version. So this session is being recorded, and so whoever has registered, all of you who have registered today, I will follow up and send you an email today with a link to the recorded version of this webinar, which you're welcome to view and share with others in your community, region, and state. I'll also send you a PDF of these slides that we'll be looking at, so you can share those as well, and a 1-hour CEU certificate. Just type your name in and print out a copy for your records if you need that. So that's what I'll be sending you today, and I'll be asking you to also give us some feedback if you have a couple of minutes to let us know how things went today. So this is the topic: youth substance use, sport prevention plus wellness. That's what we'll be focusing on. Or I should say 4 objectives for today's webinar. The first, to explore the contents of the single session evidence-based sport prevention plus wellness program manuals for high school, middle school, and elementary school. So we have 3 versions of sport: our single session evidence-based prevention plus wellness program. So we'll look at the contents of the program in the manual. And like I said, we'll primarily look at the high school version because of the time limitations. Secondly, we'll compare scripts for providing the sport PPW or Prevention Plus Wellness program to youth individually versus in group, and face-to-face versus online. So with the current coronavirus pandemic, we've quickly put together some free training. We just had a third training yesterday. It's a 1-hour training on online strategies for implementing our programs. If you missed that training, we do have a link on our website for a recorded version of that, yesterday's training, and as well as the PDF slides for that. And so you'll be able to find that at preventionpluswellness.com and look under the news items, and you'll be able to see that information. So we've quickly developed some protocols for implementing our sport and other Prevention Plus Wellness programs remotely. So that's, if you have our programs, you can get the revised digital downloads of the programs at no cost to you. And if you purchase a sport program, for example, or any of our programs now, they will include the protocols for providing a program, not just face-to-face, individually or in groups, but also remotely or online. Thirdly, we'll review the updated PowerPoint slides and reproducible materials found in your digital download. And lastly, number 4, identify online program implementation and evaluation tools and training. So a lot of things to cover today. So let me just go ahead, just to cast things in a certain context here. There's been some research, a seminal research back in 2010 by Fox and colleagues that showed that, and this was a national study in the United States, over half of high school students are engaged in 2 or more risk behaviors. And they concluded that, the researchers concluded that interventions at the clinical and community levels, and I would say school levels as well, should target multiple risks that adolescents are experiencing. I would say adolescents and young adults. And and particularly the interrelatedness of health risk behaviors should be addressed. That's what we do with our Prevention Plus Wellness programs, including sport. They're unique in that they integrate Substance use avoidance with the promotion of protective wellness behaviors, particularly physical activity and sports, nutrition, sleep, and stress control. All of those behaviors are interrelated, and youth are likely to be at risk for those chronic disease risk behaviors like being physically inactive, not eating a regular breakfast, and not eating nutritiously, not getting adequate 8, 9, 10 hours of sleep, not controlling daily stress. So these are common risks. They're chronic disease risks, but they also interact with the risks for substance use. So that's why there's a need for addressing multiple risks. And there's advantages. There's real advantages, research shows, to for young people and adults following a healthy lifestyle, meaning eating nutritiously, getting adequate sleep, getting regular physical activity, practicing strategies to control daily stress. And I would say even more now than perhaps in the past, because of the added anxiety and stress due to COVID-19 in our lives and how it's disrupted all of our lives and challenged us. So very, very important. And there's real benefits from, number one, improved physical and mental health and self-reported quality of life, all the way, as well as number two, positive images, so on, all the way down to 6, improved academics and reduced chronic diseases like heart disease, diabetes, cancer, stroke, etc. So lots and lots of benefits to this healthy lifestyle, including number 3, for those of us that are prevention specialists or focused on this kind of a thing, less depression and anxiety, us mental health professionals, and less alcohol, tobacco, and illicit drug use. This is what's associated with a healthy lifestyle. That's why we integrate prevention with wellness. Now, just a quick overview of the Sport Prevention Plus Wellness program for those of you that are unaware of it or not fully aware of it. Again, Sport Prevention Plus Wellness, or PPW, is an evidence-based program. It's proven to prevent alcohol, tobacco, cannabis use, and increase physical activity among non-using and substance-using youth. As I mentioned before, it addresses physical activity, healthy nutrition, sleep, and to a lesser extent, stress control. It's a single session program, and it's able to do that because it's a screening and brief intervention. Screening and brief interventions are the most proven and powerful interventions for motivating behavioral change that we know as practitioners and as based on science. So it's a screening and brief intervention. We have 3 versions: high school, middle school, elementary school, and all of them can be implemented under 50 minutes. You implement this program with the slides that come with the manual. You get a manual that has your scripts in it, literally a script you can follow to provide your program individually or in a group. Originally, it was face-to-face, but now it can be adapted, and we have protocols for providing it remotely online. All of our programs at Prevention Plus Wellness are founded on the behavior image model, which is a marketing theory which focuses on providing positive images to increase motivation for change. Sport also includes optional parent materials, particularly 4 weekly flyers that can be mailed out, handed out, sent out, emailed, put on your website. So there's an additional intervention. So you don't get just the screening and brief intervention, but you also get some parent material. So all of that is packaged in your manual along with your digital download. And it's just a single purchase. So it's one price, $4.99 is the price. Once you have this as a practitioner, provider, teacher, there is no other cost. You don't have to buy any other materials. You can make copies of whatever you need from your digital download. So that's sort of a real money saver. And the only other expense is whether you want to take and we highly recommend taking the 2-hour live online program implementer training. The cost of that is $199. So anyway, I'll be going over a little bit more of all of this in just a minute. Sport Prevention Plus Wellness, as well as all PPW programs, are screening and brief interventions. Screening and brief interventions are considered evidence-based practices by the Substance Abuse Mental Health Services Administration, or SAMHSA. So, and in addition to that, we've got Sport and In Shape, Sport for Youth, In Shape Prevention Plus Wellness for Young Adults. Both of those programs are evidence-based programs because they're listed on evidence-based registries like NREP, Blueprints for Healthy Youth Development, a bunch of others. So the process there for evidence-based programs is that the programs are first evaluated rigorously. We actually provided or ran several randomized controlled trials. Then the results are published in scientific refereed journals, and then they make their way into evidence-based registries. Our other programs are considered evidence-informed because they're founded on the evidence-based sport and in shape models, as well as screening and brief interventions, but they haven't been evaluated fully at this point. So evidence-based versus evidence-informed, that's how we look at it. There's 3 steps to prevention plus wellness programs. First step is screen young people for their current health habits. This increases their awareness of their health behaviors, not just substance use, but these other protective wellness behaviors of sports, physical activity, nutrition, sleep, even stress control. Second step to prevention plus wellness programs is you provide feedback to youth about their health habits, and you use positive image terms and the actual illustrations which cue desired images of young people in the future that increases motivation for change. And then thirdly, you assist young people to complete a goal plan and contract to avoid substance use and increase protective wellness behaviors, and to monitor those behaviors over time, increasing self-regulation or self-control skills, which are so much needed among young people as a part of their positive development. Now, there are 3 options for providing sport prevention plus wellness, and actually all prevention plus wellness programs. You can provide it face-to-face. That's how they were originally developed. Ideally, one-on-one, that's the most tailored approach, but you can also provide them in a group. We have scripts for that in our program manuals. Also, you can provide it live online. So as I said, we've been offering this free online training for program providers, and we are showing protocols to provide your sport or other prevention plus wellness programs live online or remotely. And then thirdly, we have some videos that we've been creating of our programs. So if you want to, you could literally just share the link with your young people of a program, and they could view the program being run on video. And so that's a third option. So you've got 3 options. All of our programs can be tailored very easily. And mostly, if there is tailoring that organizations do or professionals do, it's usually they focus on the PowerPoint slides. Very easy to switch out some of the images, even a word or 2 here and there. And in the during the live 2-hour online training for program implementers, we can help you with this process and discuss it further and tailor it to your setting or to your population's needs. I'll just give you one quick example of this. So we have some providers of sport prevention plus wellness in Montana, and what they did to tailor to their setting, which is a mountain state, a lot of outdoor activities, not so much organized sports. So they took out some of the images showing organized sports like basketball and so on, and they replaced them with images of young people engaged in outdoor activities, hiking, snow skiing, fishing, that kind of thing. So that's just one simple, easy way to tailor it. But you can also co-brand your slides, put your logo on it, your organization's name. So we're willing to work with you on that. And then some organizations even do more in-depth tailoring or customizing, changing the language, for example, or adapting to some other cultural differences. We can help you with that. We have had a number of adaptations of sport and other prevention plus wellness programs over the years, so that they've gone from, the evidence-based sport prevention plus wellness program for youth, high school, middle school, then adapted for elementary school, the evidence-based in-shape prevention plus wellness. And then from those, we've developed other programs based on requests from our, from organizations throughout the country and world. So that's why we developed the vaping prevention plus wellness program to address specific messaging about e-cigarettes, the same with marijuana prevention plus wellness, opioid prevention plus wellness, in God's image, a faith-based prevention plus wellness program, very unique, and a Sport 2 prevention plus wellness program, the only multi-session program. We provide 6 sessions if you want to have extra content. And our programs over time have been adapted or adopted to be used not just as universal prevention interventions for all youth, but also in selective indicated populations. In other words, varying degrees of high risk or higher risk or using substances. So lots of flexibility in using prevention plus wellness programs, including Sport PPW for youth. And you can see some of the other adaptations there. The messaging that's provided in sport prevention plus wellness is a 2-step process, with the goal being for these messages, this communications with youth, to trigger a mental picture that they have of in their minds already of a healthy behavior and substance use as being counterproductive. And this is done largely through the use of vivid terminology and illustrations. And it's a 2-step process, as you can see here. Step 1, you present positive desired future and peer images and other benefits of a selected wellness habit. So again, the wellness habits that are addressed in sport are physical activity and sports, and healthy breakfast and nutrition, and adequate sleep in particular. Then the second step to the messaging is you present how, or the scripts in the programs present how substance use behaviors are barriers to or interfere with achieving those positive wellness behaviors and the benefits, including the desired images. All of this, all of sport and all prevention plus wellness programs are founded on the behavior image conceptual model. BIM is a marketing related theoretical roadmap for developing cost-effective, I would say, programs, brief programs if you want, or longer if you wish, but as brief as a single session, and that integrate the promotion of wellness, protective wellness behaviors with the avoidance of substance use. Now, there's 2 main components to the behavior image model, as you can see here in the lower right-hand corner. Number 1, it uses positive images to increase motivation for change. We know this from research, from theory. You use positive images, image terms, and this triggers imagery in the minds of the youth unconsciously. That increases motivation for them to change their behaviors, especially because they know what their behaviors are because they completed a screening survey. Secondly, you walk young people, these extra motivated young people now, through goal setting to initiate that change. And that goal setting is just not to avoid substance use, but also to increase wellness behaviors and to teach them how to set goals and monitor their behaviors over time. This increases self-regulation or self-control skills. But sport and other prevention plus wellness programs also address a number of other substance use risks. The one on the top there, certainly our PPW programs address how substance use is a barrier to each of the targeted wellness behaviors, as we mentioned before. How does substance use interfere with physical activity, sports, nutrition, sleep, stress control, but also these other issues, how substance use harms fitness and health, causes life problems, myths, and so on. So there's a range of content, risk content, even though the images are very positive, the communication is positive, still risks are addressed in your sport and other prevention plus wellness programs. Now, you can get more information, and I'll be sending you a PDF of these slides, so you're welcome to pull them up and click on these links. But you can go to our website, preventionpluswellness.com, and you can find some additional resources. There, we do have on preventionpluswellness.com, we do have a listing of our programs. You point your cursor at programs, you'll see the drop-down menu, and you'll see Sport PPW. That's a link. We also have this link here. The second link is for program, a redacted sample of the Sport PPW program. I think that's the high school version. You could look at it. If you want to look at the other versions of Sport Middle School, Elementary, or any of our programs, just shoot me an email, say, or go to our website, preventionpluswellness.com, and click on the send a message and say, hey, I'd like to see a sample of whatever program. We're happy to send it to you. And there's even a 2-minute video, a clip of a video of the video version of the Sport Prevention Plus Wellness program. And even if you're not interested in, using videos for your youth to implement sport, you get a sense of how sport is implemented by viewing that 2-minute video. And there's a link to that on the bottom of this slide. We also have a new online program tools. On the left, we've got online prevention plus wellness goal contract. So we developed this as an option, and more likely as a go-to method to provide the goal setting. And what we have is we've got a SurveyMonkey goal contract. And so we can provide you with a customized link that your organization could then send to your youth, and they can complete their goal setting online, and you could have access to the grouped responses. How are your youth setting goals? What substances are they avoiding? Which wellness behaviors goals are they setting? What did they like about the program, not like about it? So you can collect a lot of information online from our goal contract. And also to the right, we do have a pre-post test online now. And so if you are providing a Sport Prevention Plus Wellness or any of our programs online, you can also send a link to the pre-test to your participants, and then a post-test after the lesson, and you could literally see the results, how things are going, how are you changing youth on critical indicators of behavior change. So these are extra things that we can provide. Those are links so that you can actually see them, and we could send your organization, if you're using our programs, we could send you as a professional or your organization a customized link. So just you or your organization can gather the goal setting information and pre-post test just for your use. We have a number of training opportunities. As I said, we've been doing the last 3 weeks in a row. We've offered this free 1-hour PPW program online strategies training. We'll probably wait another couple of weeks before we offer it again, but you can access it right now online on our website, preventionpluswellness.com. Point your cursor at news, and you'll have a drop down, and you'll be able to see there's a link to the recorded session and the slides. We also are continuing to offer our very popular 2-hour live online program implementer training. That's $199 for those that want to take that training. And then we have an online 2-hour live online training of trainer workshop as well. Now, we also have on our website a number of free resources. So I'm going to show you where they're at. It's in this slide right here. There's preventionpluswellness.com. If you point your cursor at more, you'll see a drop down of all of our free resources. So do take a look at our website, preventionpluswellness.com. And you'll also see a window pop up to provide your email. Do provide your email so that you stay up to date with all of our free webinars and program offerings and research and so forth. You just have to type in your email to get on the mailing list. Now, if you have more information, you want to contact us for anything, you can call me at our office here in Jacksonville, Florida. There's our number, 904-472-5022. You can write it down, but again, I'll be sending you a PDF of these slides so you can have it as a record. Also, you can email me anytime at info@preventionpluswellness.com, And there's our website again, preventionpluswellness.com. We're really focusing on now providing tools and resources to help prevention specialists offer our evidence-based and evidence-informed programs to youth remotely through live video, through live online presentation, using our updated PowerPoint slides, and step-by-step procedures for providing your program online, as well as an optional videos if you want to go that way. And so that is some slide. That's it for the slides. Let's go ahead and now transition to the program manual. We'll start by looking at the high school manual, and I think we'll take a look at, and all the manuals, high school, middle school, elementary school for sport, have the same contents. There's six chapters or sections. There's an introduction, step-by-step directions for implementation. Section 3 has your protocol or script to provide the program to one youth at a time. That's the most tailored format. Section 4 has a script or protocol to provide it to a group of youth or a classroom. And so you can do this face-to-face, and again, you can do this online live. Then Section 5 has evaluation materials. We'll look at those. And then lastly, there are the parent flyers that I talked about. So let's take a look at what's in your manual. You get a physical manual. You get a digital download of all of your reproducible materials. So we'll go past the directions and step for implementation. Let's just take a look at the individual script. So this is the script you follow. And the beauty of the script is that that training is shortened to just 2 hours live. So, you know, because you've got a script, it makes implementation easy and replicability very highly likely. So it doesn't matter if I implement sport, you implement sport, somebody else implements sport, they follow the script, it's going to be the same content. It's going to be reliable over implementer. It's going to be reliable over time. If you implement it today and next year, follow the script, it's going to be the same program. And so that's the beauty of it. You practice the script 3 or 4 times, you get comfortable with it, and you're able to focus on good presentation skills. So very, very advantageous to have a scripted program. And yet you do have flexibility with your script. As we talked about earlier, you can tailor your PowerPoint slides, for example. So let's take a look at this is what would happen if you were to implement your program either to one youth at a time, whether it be face-to-face or let's say online, using an online video conferencing system like Zoom or GoToMeeting or Google Classrooms or Microsoft. It doesn't matter what. You'd be here, your youth would be there online, and then you are literally, you'd show your initial slide. That's the introductory slide. It says introduction, show slide. Just follow the script, and then you read your introduction section. Hi, you read your youth's name. My name is so on, and this we're going to be talking about for the next few minutes. This exciting new prevention and health program. Then you're going to ask them to complete a screening survey. This is that first start of all of our programs. You're getting youth to think about their current health habits, and we have the screening survey items built in to our newly revised slides. So that makes it much easier, especially if you present this program remotely online. So here's the, for the high school version of sport, here's the screening survey. Here's the first question: what are sports and physical activities, or what sports and physical activities did you play in the last year? And then they go through this list, and it's a long list. Everything from baseball, softball, to basketball, all the way down to weightlifting, and then even to other S. So you can encourage them to fill in some other sport or activity. Did they do any physical chores, clean the house, mow the yard, work, outside, do some physical labor? And so that's the first question. So they identify what they've done in the last year. The second question is an assessment of regular physical activity. Do you participate in physical activity for at least 30 minutes, 4 or 5 times a week. For example, riding a bike, running, walking, so on, yes or no. Third question is an environmental social norm question. Do your friends influence you to participate in regular physical activity, yes or no? Question 4, do you usually eat a healthy breakfast each morning? For example, cereal, low-fat milk, whole wheat toast, oatmeal, eggs, yogurt, fruit. And the answer again, yes or no. Then question 5, do you usually get 8 or more hours of sleep? Yes or no. And question 6 is the substance use item. Sport focuses heavily on alcohol, but does address other substances in some of the slides, and a whole range of avoiding of substances in the goal plan, including avoiding alcohol, tobacco, e-cigarettes, marijuana, opioid misuse, and other illegal drugs. So question 6, though, is the past 30 days, what's the greatest number of alcoholic drinks you've had, from 5 or more drinks to 0 drinks? And then, are you a male or female? And that question is asked because when you provide this one-on-one, you're going to tailor the response, whether they're male or female. Now that's it. That's the 7. It's very brief. Most of our screening surveys are either 5 or 7 items. Takes only a few minutes. Then after that, there's a pre-test, and you're welcome to collect the pre-test. It's a scannable form. If you collect the pre-test and post-test and scan them in any printer scanner and send us the PDF, we have the software to run an analysis for you for free. So that's just an option, pre-test, post-test, built in a scannable form. And we also have links to the pre-test, post-test. So if you provide this remotely, you can send the link to the pre-test, post-test to your youth before the lesson, after the lesson, and you can see how well you've had an impact on changing critical predictors of health habits of your youth. So that's the first step. You ask them to assess their own health habits. Secondly, you're going to provide feedback. Now, remember, this is the script for one-on-one. You're presenting this to one youth at a time, face-to-face or online. And so you're going to provide feedback about that first item. That first screening survey item was, did they get any physical activity in the last year? And if they said yes, then you're going to read the yes response. Yes is highlighted in green. Yes, go, green, good. And if they said no, they got no physical activity last year, you'd read the no response. No is in red, meaning risk, higher risk, stop, that kind of thing. So you'd read one response or the other. So let's say that your youth said yes, they got physical activity in the last year. Remember the messaging is a 2-step process. Step 1, which is the first slide, highlights the benefits of sports and physical activities. And then the second slide, the second communication, is how alcohol and other substance use interferes with physical activity. So let me just show you how this goes. You'd show the first slide, and then you'd read the response. Oh, I see that you participate in, and you can read some of the items that they checked off, or that they told you about: wrestling, horseback riding, surfing, skiing, walking, biking, baseball, etc. Good for you. Sports and physical activities are a great way to get regular exercise. Sports and physical activities are fun, help you look fit and strong, and those are really key, powerful image terms that automatically cue an image of themselves in the future and increase motivation for change. And then you show the second slide, say, but an active lifestyle and alcohol do not mix. Using too much alcohol can hurt your performance in sports, physical activities, school. It can also have a negative impact on your health, relationships with friends and family. So that's the 2-step process. If your youth said no, they got no physical activity, you'd read the no response. And here it is. I see that you do not play sports and physical activities. You can really improve your health and how well you feel by being more active. So notice the feedback is tailored to the individual youth, depending on how they responded to their screening survey. Either you're going to provide positive customization or you're going to provide a neutral response. But the rest of the content's the same, the slides are the same. You're going to cue positive images related to that wellness behavior, and you're going to show how substance use is counterproductive. And then you continue to provide that feedback to individual youth for each of the items that they answered on their screening survey. Regular physical activity, if they said yes, you read the yes response. If they said no, you read the no response. And that continues all the way through all the questions: breakfast, sleep, and then all the way down to alcohol. Once you get to alcohol, there's a little bit more content, because our substance use items, we're addressing other risk behaviors, additional risk behaviors. So for example, for alcohol, this slide is addressing how alcohol can harm your fitness and health. This slide addresses and content addresses how alcohol can cause life problems. Another addresses how myths associated with alcohol use. Most kids do not drink alcohol. That's a social normative messaging. Choose for yourself to avoid alcohol use. Plan ahead. And then a summary of the risks associated with alcohol and drug use. So, and then this will be tailored depending on how many drinks they had. If they don't drink at all, or if they've tried alcohol, there's a yellow response, some risk. And of course, a higher risk is if they have had any alcohol, then it's a red, higher risk. So the message is tailored to that individual youth, whether you provide it to youth one-on-one, in person, or online. The third step to the process of sport and all PPW programs is walking them through a goal plan and contract. And so there's a recommendation to engage in all of the wellness behaviors: nutrition, sleep, physical activity, and avoiding alcohol, tobacco, e-cigarettes, etc. Having them pledge to avoid substance use in the next 7 days, and identify at least one other protective wellness behavior to work on the next 7 days, and to identify it specifically in terms of what's the measurable behavior, what's the quantity, frequency. Then the youth signs it, and then you sign it and co-date it. This increases motivation for change. This makes it a contract. Then there's some wellness tips, and then there's some very important concluding statement. And that's the strategy. That's the goal. That's the script for implementing it one-on-one. And then you also, in your manual, have a script to provide it to a group of youth. That means 2 or more. And that could be, again, face-to-face or online. Same slides, same content, just a little less tailored. Obviously, the feedback is not tailored to each individual. So the feedback is a little bit more generic. But remember, each youth is completing their own screening survey, thinking about their own health habits, and completing their own goal plan. That's ultimate customization. But the feedback is generic. It just, everybody gets the same feedback in terms of what are the benefits and what are the barriers to each of these, related to each of these behaviors, to the whole group of youth at one time. So that's the process for implementation individually. There's also an interactive group exercise if you wanted to do something in addition to one lesson. This is an optional second lesson. And then you have evaluation materials. You've got a pre-test and a post-test. We call them a screening survey addenda and feedback survey. We'll be changing that, but the main point is that you have a pre-test, post-test that's scannable. And the main measures, we've reduced the size of this so it's more practical. The main measures are behavioral intention. Here's an example of the behavioral intention message. Behavioral intentions are the most highly predictive, correlated indicators of future behavior. And so here's how it's worded next year. How likely are you to, on a 4-point scale of not at all to very. And notice you're measuring not just alcohol, but cigarettes, marijuana, e-cigarettes, other illegal drugs, and the wellness behaviors of regular physical activity, sleep, nutrition, and stress control. And then the second measure is perceived harm or perceived risk. How many, oh, I'm sorry, here it is. If you used any of these regularly, would they harm your health or health habits? From yes to no, 4-point scale. And you're measuring not just alcohol, but cigarettes, marijuana, e-cigarettes, and other illegal drugs. So those are your two main measures, as well as a couple of open-ended measures. We also have an instructor survey, which is a process survey, which every instructor can assess their level of comfort and quality of program implementation. And we also have a program fidelity checklist. There's also a protocol to call parents if you do send out the youth flyers. And related to the flyers, that includes a letter to parents and then 4 of these flyers. And the purpose of these flyers is to just get, not just, very importantly, get parents on the same page of providing positive image communication along with you. So this is an optional tool, optional intervention, completely separate. If you want to use it, you can use it, and that's provided in all sport prevention plus wellness programs. So let me see. I just wanted to show you one other thing. I'd like to show you. Let me see if I can find the slides. So you can see the slides. So here they are. Let me see if that popped up. Let me just, there we go. A little slow right now. So I've got a lot open on my computer, and let me share those slides with you, just so you get a sense of what's in the PowerPoint slides that come with your program manual and digital download. So here are the slides. This is the high school version slides. These are newly revised, so that make it better and easier to provide your program, not just face-to-face, but also online or remotely. So here's your SPORT PPW program for high school. And it says, complete the health and fitness screen. So you have your health and fitness screening questions right there on your slide. So you can walk your youth through these slides. They can answer. If they don't have a copy of the screen, they could answer on a sheet of paper. And so they're doing their own assessment, assessing their own, what sports or physical activities did they play last year? Did they participate in any regular physical activity? Did their friends influence their participating in regular physical activity? Did they usually eat a breakfast every morning? Did they usually sleep 8 or more hours? And did they, and how much alcohol have they had in the last 30 days? And then with that, you're going to restate that question. What sports physical activities did you play last year? That was the first. And you're going to provide feedback depending on what they said, yes or no, depending on whether you're implementing this to one youth or to a group. You could tailor it, you could read the script in your manual, and you could show the slides. And so, and then we've added some reflecting or discussion questions as well. So there's a little bit more interaction, which I think is especially important when you provide this online. What types of sports or other physical activities would you like to try or do more of? And so we've had that built in as well, those discussion questions. So there's the slides, there's the content, that you're going to highlight the benefits of healthy breakfast and healthy foods. And then you're going to also show how alcohol and substance use robs your body of vitamins and minerals. And so that's the feedback. There's the slides, and you follow your script, you show the slides. And then again, if you want to present this online, if you're presenting this online, you have this option of you could send your youth a link to the online goal plan contract. And then here it is, the contract itself. So you can walk you through it. They can complete it on a sheet of paper, and then you could send them a link and they can complete it online, and you could have that data for your evaluation. So the first question, in addition to some demographics, the first question is, which of the following substances will you avoid during the next 7 days in order to maintain an active and healthy lifestyle? and they could check off or write any of those, anywhere from alcohol, marijuana, and they could even identify something else if they want. Then they're going to identify which of these healthy habits are they going to focus on. They're going to write a goal to either get more sleep, eat healthier, get more physical activity, or practice some stress reduction technique, and so forth. So you walk them through the goal setting and then send them the customized link. That customized link is just for your organization so that you can have a record of how your youth as a group completed their goal setting. And if you want, a pre-post test. So, all right, let me stop at this point. I know I roared through that, covered a lot of content very quickly, but I wanted to see if you had any questions and wanted to have any other feedback. So I'm going to stop at this point. You've got a chat option on your screen. I think it should be down below. And so if you have any questions about sport, now what is the difference between sport for high school versus sport for middle school, elementary school? The content is more similar than different, but certainly it's tailored to the developmental level, and the images are obviously different. So when we have elementary school sport, you're seeing pictures, illustrations of little kids participating in these fun things. They're adorable pictures. So different than the high school version and different than the middle school version. So that's the main difference. So if you're presenting, if this sport program or you plan to present it to high school and middle school kids, you should really have a high school and middle school manual and digital downloads presented. Every provider, every teacher implementer should have their own manual, but if you have a budget issue, you can't afford that, then you're welcome to share the manual. You just can't make copies of it because it is copyright protected. So those are your options. If you have questions about how to pilot the program, see how it works for you, and then sort of build on that, a lot of organizations will do that. They'll see what the reactions are to youth or stakeholders or parents or teachers. You're welcome to do that. Just let me know. I'm happy to walk you through how to best do that based on our experience. And sport is being implemented in all 50 states and in other countries. So it's very, very popular program because it's very practical. It can be implemented in any setting. Just think about this. You may be using other prevention programs, even other evidence-based programs, but because they're multi-session, you're only going to be able to reach a certain portion of those youth in your region. With a single session program as ours, being positive, focusing on positive behaviors, you can have a true public health effect, and you could reach almost, if not all, youth in your community. So that's the beauty and the blessing of the sport and other prevention plus wellness programs. Okay, I'm going to see if there are any chat questions. I don't see any. I pushed the wrong. I clicked on the wrong. There it is, chat. So I don't see any questions. Anybody have any questions, any comments? I'm happy to stay here as long as you have anything you want to ask me. Any questions about implementing this one-on-one or in a group or in person or online? Any questions about the content in the manual or the digital downloads or the slides? Once you have your manual and download, you can implement this to dozens, hundreds, thousands, millions of youth, as long as you have it. You don't have anything else. It's a single purchase price, $4.99 for the manual download, $1.99 for the online program implementer training. We have a train the trainer 2 hours live as well for $3.49. So if you want to train your other program implementers in your organization, region, state, if you want to train youth to implement this, we do have quite a few organizations that train youth as a youth leadership experience to provide this. Now, here's something new that we haven't done, and this is an opportunity, something to think about. I'd love to work with any organization that'd like to try this, and that is to train youth to provide this to their peers online. That's possible because, again, very practical, single session, scripted program. something to explore, to think about. All right. Looking at live chat, I don't see any questions. You sure nobody has any questions, comments about Sport PPW, high school, middle school, elementary school? Our spin-off program, by the way, In Shape PPW is for young adults, whether that be in college, communities, military, what have you. And then our spin-off evidence-informed programs, vaping, marijuana, opioid prevention plus wellness programs in God's image for faith-based settings, Sport 2, 6 sessions. Let me know if you have any questions or comments. And I'd love to have answer anything you might have. Still not seeing anything, so I'm thinking everybody understood what I've got. Please do go to our website, preventionpluswellness.com, and check it out and get familiar with it. Remember, under the More setting, M-O-R-E, there's free resources. And remember, if you provide your email, we'll keep you in the loop with updated free webinars and materials and so forth. So we're continually upgrading and revising and improving our programs based on the feedback from people like yourselves, professional prevention, health specialists from throughout the country and world. So let us know what we can do. If you need us to create something specifically for your setting, different topic, different, whatever, let us know. We're a small organization. We have a lot of flexibility. And that's really how we developed our other programs like vaping, marijuana, and opioid prevention, because organizations came to us and said, hey, we really would like to have this. And so let me know what you need. I think that's just about all I have to say. Let me know if you want to have a sample of any of our programs to look at, redacted sample. And remember, I will be sending everybody who's registered today a follow-up email very shortly with a link to this recorded session, as well as a PDF of the slides from today's session, and a 1-hour certificate that you just type your name in and print out a copy for your records. And that's what I'll do for you. And if there is anything else you need from me, just let me know. I'm happy to help in any way that I can. All right, I still don't see any questions or comments. So last chance, I'll give you just one more minute in case. I don't want to cut it off too soon. I did get some feedback once from somebody recently, said, oh, we wanted more time for Q&A. So I don't want to miss anybody or dampen anybody's enthusiasm to send me a note. If we end things today and you remember you wanted to ask something, just shoot me an email at info at preventionpluswellness.com, and I'm happy to address any question you might have or anything you might need. All right, that's it. I see nothing else. So I'm going to say goodbye. God bless you for what you do. Thank you for what you do in your communities with youth, with families. Take care of yourself. As I like to say now, keep yourself healthy. Make sure you are getting plenty of sleep and exercise and eating well and practicing stress relaxation and certainly social distancing. And if there's something I could do to help you provide your Prevention Plus Wellness program remotely, let me know. Would love us to continue to provide. In fact, I think it's essential. We shouldn't drop the ball. Youth need to have prevention messages, particularly prevention integrated with wellness messages now more than ever. So if you need something from me to make that happen, let me know. Thank you. And yes, you also have a great Easter and a great holiday, and stay safe, everybody. Goodbye. Thank you.